name is Sylvester, an emergency medical services instructor with Medswift. We do know what to do in the event someone has a seizure. Seizures are involuntary muscular contractions as a result of disturbance in the brain electroactivity system. This could be due to conditions such as high temperature, lack of oxygen, abnormal sugar levels, epilepsy, among others. In the event you bump into someone with a seizure, make sure that you ease the fall so that they don't hit the head on the ground. Your main aim when managing an epileptic or any other form of a seizure is to make sure that the casualty remains safe and the airway remains clear. There are a lot of myths that are associated with management of seizures. Do not put anything in their mouth. Do not restrain your casualty. Do not move your casualty unless it's absolutely necessary. Let your casualty have the fits. Don't put anything in their mouth while they're still having a seizure. After the seizure, roll them over to the side so as to maintain an open airway. Seizures are not contagious. Don't run away from a casualty who has seizures. Instead, your presence is very important because you need to make sure that the area is safe for them. Then after the seizure, roll them to the side if injuries permit so as to maintain an open airway by ensuring whatever that's in their mouth, such as froth, clears off. You become unconscious in the middle of this, checking inside your mouth, so there's an obstruction, opening your airway, that you can breathe well. You see you're breathing well. I'll turn you to the side so to make sure that your airway remains clear. Lower your head down and maintain the head tilted well back. Okay, because you're still breathing normally. Okay, don't worry, I'm here to assist you. I'm a trained first aider. Okay, everything will be okay. All seizures are supposed to be seen by a doctor. However, treat them as an emergency if it's the first time it's occurring in that particular patient. The seizure recurs, the seizure lasts for more than 5 minutes, or this patient has an injury that requires hospital treatment. Seizures are not contagious. Don't hesitate to help your casualty. In the event you bump into someone with a seizure, make sure that you ease the fall so that they don't hit the head on the ground. Your main aim when managing an epileptic or any other form of a seizure is to make sure that the casualty remains safe and the airway remains clear. Welcome to Medswift. You can contact us through the numbers provided below. We offer a wide range of services. We do first aid training, fire safety training, occupational health and safety. We also do have tailored programs for different situations. Don't hesitate to contact us and enroll for training and get hands-on life-saving skills. Bye.